2, 1.
What's up, guys? John here. Titan Talk Tuesday coming at you. It's a fresh new week. Thank God. Summer is here. We're finally, we're starting to get in the middle of June coming up. My son's birthday is this week. So big shout out to him. Big shout out to Derek and Drew for their birthdays too as well, which are today. My team is growing older, more experienced, and more wiser. So it's a beautiful thing. So we always got to give them shout outs. My son's going to turn 11, which is crazy. I can't believe it. But it's going to be really, really cool to see. I mean, God bless, man. I mean, he's been getting bigger and bigger. So he's almost as big as Charisse. If you guys have not seen any pictures, I only post them a little so often on social media. But what's up? How you guys doing? Nice to see you guys. Paul, Anthony, Big Dog, BB or BKB, Chris, how you doing? Classy yet sassy. What's going on? Swog or not? What's going on? How you guys doing? So, got a great show for you guys today. It's June, so we talked about that. It's Men's Health Month. So, it's focused on men and it's focused on health. We're going to talk about why Men's Health Month is so important and why men's health is so important, right? Because we got a lot of things we got to do as men or males out there, and we got to make sure we're healthy. So, we're going to talk about some of the different things that could possibly help you guys out with your health and, make your life a little bit longer, a lot better. Quality of life is key, right? That's what Titan Medical Center is all about. Looking better, feeling better, performing better. If you guys don't know, I'll just tell you guys right now, we service nationwide. So whatever city, county, state that you guys live in, Titan Medical Center can help you guys out and service you guys with a number of different things. From our blood testing, antibody testing for COVID, if you guys want to do that. We do all types of amino acid blood tests, food sensitivity testing. So if you guys don't know how your diet is with what you're trying to do, or your nutrition, or how it's affecting the body, you guys can really tell. So it's really cool. What's up, Maria? How you doing? Rebecca Callie, how you doing? Iron Barbie, how you guys doing? Everybody's joining in. What's going on, guys? So we're here. What's up? Eva's on here. Jennifer Maggiano, what's going on? We were talking about Men's Health Month and why it's so important. And with Men's Health Month, every week, we're going to do a new special for guys out there. So this week, it's blood testing. And it's the full male panel. It's really, really important for men to get this panel. Obviously, to check the vital organs, your liver, your kidneys, your prostate as a male, right? Want to check cholesterol levels, good cholesterol, your LDL, bad cholesterol, triglycerides, total cholesterol. We want to see what's going on there because this is important. Got to make sure you do your glucose levels, like your hemoglobin A1C, to make sure your sugar levels in the body are proper. Want to make sure, we obviously aren't doing the blood testing through virtual, but you can get not blood testing, but your blood pressure test through anywhere around you. You can walk and get this done. You can get a home meter for yourself to make sure that's good. But blood testing, when we talk about these things, we talked about the vital organs, we talked about cholesterol and how important it is, but you obviously want to check out your hormones too. As we age as males and females out there, we know our hormones are going to decline. We know we're going to, lose out on these things. They're going to get you're going to go in deficiencies in some of these hormones and you're just going to wither away. It's kind of like a flower. Over time, we wither and we die, and that's what it is. But replacing hormones or checking some of these hormones can, optimize your quality of life. And, you might be tired. It might be concentration, might be foggy thinking, or, just overall libido or motivation. And that's where these hormones can really bring things back. And for Men's Health Month, obviously having these hormones in check and having everything else in check is going to make you guys healthier. And that's going to help out in a number of different ways, from your quality of life to your relationships to your family, everything and all above. And the way you feel about yourself, the confidence factor too, that goes right along with this. And feeling good and looking good, well, obviously you will perform better too. And feeling good on the inside, you're going to project that to the outside, right? Because you got to feel good on the inside, and the inside has got to be right. I've seen some people out there, their outside looks immaculate, like Ferrari status, like wow, right? Like Bugatti. This is a fine specimen. But blood testing will tell the true story on the inside. And some of those people, it doesn't look so good, right? It looks like, it looks like a car crash on the inside. It's just not there. So you want to make sure inside and outside both reflect healthy, looking good, and feeling good. So Men's Health Month, if you guys want to, you guys want to sign up as a male, or maybe you want to get this for your husband or your boyfriend, your cousin, or a family member, it's real simple and easy to do. We have a discount on it. It's only $130. It covers everything: liver, kidneys, prostate, total cholesterol, full thyroid panel, free and total testosterone levels, progesterone levels, estradiol levels, IGF-1 levels. It's $130, Roy Rios. So at that point, it's very, very inexpensive, okay? We're talking about your health. It's the cheapest full panel across the country. And I hate to use that word because we're not cheap at all here at Titan.
The most affordable.
The most affordable. That's great, Art. So Art just told me the most affordable. What's up, Craig Broski? How you doing, man? Stacy, I love you. All right, so this full blood panel is very important. It's going to say and tell a lot of different things on that's going on the inside, and you could possibly help your friend, husband, boyfriend, family member get better, feel better, and look better. Plus, he's going to perform better at that point too. So, do you want to do that for your male friend or family member or loved one? Yes, you do, because they want you to feel good, and you should want them to feel good. So help them out. If you're a male, maybe you're single, do it for yourself, do it for your family, do it for your future. That's really what it's about, because you might be here for a long time on this earth. You want to look the best. You know, your body is going to look the best on the outside. You want to feel the best. You want to wake up feeling good every day. So it's important for this blood panel, right? And that's one of the major things. When it comes to hormones will play a big factor for males and females. And from mood, like I said, physical appearance, the inside, how things work, metabolism, cardiovascular systems. So you really want to look into these things, make sure you're optimized, make sure you're dialed in and ready to go. Okay? So the next topic, let's get into it. Let's talk about some of the different things that are going on out there. So we want to talk about COVID-19. This was a big one, right? COVID-19. And we started opening up right now. We started, getting out there. And, I think the whole country's happy to be out of their house because they were in this, pattern where they were stuck, right? And they were like, man, we can't go out. People are going to get sick. People are going to die. The government was telling us things. CDC, the WHO, so we were all kind of scared. We were complying with what the government said. Now everybody's trying to get out, and that's great. Now, when I go out, I see some people doing what they're supposed to, social distancing, wearing the mask, and some people don't want to wear a mask. That's fine, but they're not social distancing and stuff like that. So at that point, what's going to happen is what's going on right now. We know Memorial Day weekend, they're saying that there's a spike. So at that point, if there's a spike in these numbers of COVID-19 cases, we're starting to see them now. So a lot of states are going up, and we're in Florida, and it's starting to go up. Whereas we thought we had this thing underneath control, and really now we're finding out that we don't. And especially here in Tampa, right? So I'm starting to see an outbreak like you wouldn't believe. A lot of people were out there on Facebook and Instagram and stuff like that, or social media platforms. They were asking the question, do you know anybody that has COVID-19? Because I don't know anybody that has COVID-19 is what they were saying. A lot of people were saying that. And at that point, I really didn't know anybody here in the state. Out of state, some of the patients, they tested positive and stuff like that. I've had some people out of state that I know test positive. But here locally that I know personally, like hand to hand, I didn't know anybody. But now, it's starting to get where I know a lot of people that are getting COVID-19. So this is kind of scary. And I was at the point where I thought maybe we were getting done with this and stuff like that. It was starting to die down a little bit. But now, I'm going to wear a mask pretty much everywhere I go. I'm just being honest with you guys. I tested for antibodies first, didn't have them. I thought I was sick back in February. That was not the case. I didn't have COVID-19. So at this point, made sure they tested this way, negative for COVID-19 right now. So now I'm like, I don't want to get COVID-19. I just don't want to do it. I don't want to bring it back to my dad. That's the biggest thing. It's not really the asymptomatic people, because I heard somebody, I was talking to them today, and they were like, it doesn't matter if you're probably asymptomatic anyway, so you ain't going to feel anything. But it's not being asymptomatic and you feel it yourself. It's really bringing it and carrying it and spreading it. And I have my dad retired, so at that point, if I give it to my dad, he has some of these different factors where it makes him high risk. At that point, I'm putting his life in danger, which is really scary and not cool. We really don't think about it. Some people I've seen it a lot in the hospitality industry, and these people have tested positive COVID-19. And hopefully they're staying home in quarantine and doing that, because if they go out, if they do this and they get in close contact with people, they can spread it, and that spreads out, and that can affect a lot of different people in a lot of different ways. From getting sick, maybe not getting sick, to possible terminal ill, or doing something scoring the lungs. That's another thing. So please, guys, please make sure you guys are getting tested. If you guys haven't got tested, it's real simple and real easy to get COVID-19 tested. Now, we offer the testing here, but we have to charge for it through LabCorp or anything like that. Guys, get it for free. I've heard some people, they told me CVS, you can call ahead, you answer some questions from there, like have you been in contact with people, some of these different questions, and at that point you can sign up and you can go through their drive-through and actually do the swab test. That's the way to go, guys. I want you guys to have the best information out there, so I'm gathering more and more about collection sites and stuff like that, so you guys, if you guys have questions about it, you can bring it up to me on air and I'll try to help you guys out of where you guys need to go. But CVS has been the big one. CVS with the drive-thrus, I know a lot of people have been going through there and getting the test results back in a couple days. It usually takes about 3 days for some of these places. Some are 2, right? So make sure you guys are getting tested. If it's free, go do it. You have no excuse, no issue. Go do it. Go check, make sure. Now, getting that COVID-19 test, with the negative, let's say you came back positive or negative. Let's say you came back negative, because positive, you're going to quarantine. You know that. Negative, you have negative, but you still got to be careful because you can still be exposed to it and still catch it after the test comes back negative. A lot of people, man, I came back negative like a month ago. Well, you're still being exposed daily possibly to people that could be infected if you're leaving your home and not quarantined, or you're not, staying at home. I mean, some people are, but a lot of people aren't. And a lot of people have to work. So they're coming in contact with a lot of different things, especially in hospitality. So I want you guys to make sure you guys are safe out there, because it's not a joke. I know, like, some people were literally like taking it as a joke. We're like, because it hasn't affected us personally, and it's hard to realize or hard to visualize. But when it does affect you firsthand, you guys will then get the experience like, I better start listening. I better start doing the right thing. So it is what it is. So make sure you guys are getting tested. Make sure you guys, if you guys think you had it, get the antibody test and get it from a reliable source. Make sure you're going to somewhere that's accredited, not some test that you bought off the internet. Make sure you're going to somewhere that is accredited. LabCorp or Quest are probably the most accredited places as far as laboratories across the country. Okay? So that's probably the best way or best place to go. Got it? All right, check it out. Let's see about CrossFit. CrossFit problems. Let's bring this up, and I was talking hard about it earlier. So CrossFit. If you guys don't know, CrossFit is a trademark name. So anybody that has CrossFit in their gym logo or name, so CrossFit Tampa or CrossFit this or CrossFit that, they actually have to pay this company that created CrossFit, and they trademarked the name and coined the name. So they've came under fire in this last week because of kind of what the CEO wrote on a Twitter post. He made a remark about George Floyd and COVID Floyd or something like that. It was a real vague remark, but a lot of people are very sensitive right now because of what's going on, and especially using somebody like George Floyd's name, who got killed the way he did. So at that point, there's been backlash through all these big companies, but his company was one who got affected. The CEO had to step down from CrossFit, and they've lost a lot of money. And that's where it's really hitting the mat, is in their pocket, because the first one was their basically their advertiser. It was Reebok. So Reebok and the CrossFit Games. I know you guys, if you guys are into that. I'm not a CrossFitter. I like to lift weights, but I know a lot of people that are into CrossFit, and it's a huge sport now. So at that point, Reebok is canceled the contract with CrossFit. They're not going to get out of it, I guess, out of the scene or whatever, but they're going to get out of this contract with them. So that's one that dropped, and then a lot of these gyms have been dropping the CrossFit name from their name, and at that point, so they're losing out on money. That's what it ultimately comes down to. CEO has to step down. I mean, there's a lot of bad things going out there as far as this goes, as far as people losing their jobs, losing their businesses, or losing their positions in high-profile companies out there. A lot of crazy stuff. I know you guys have been watching some of this, right? All right, so next thing is this famous Mike Tyson line, and it's so true because it really does hit home. It's basically everybody has a plan until they get punched in the face. So that means that you can ride out. What up, Rodney? How you doing, big dog? Dude's out in Venice, man, looking swole. So at that point, everybody has a plan to get punched in the face. And this breaks down to, it doesn't matter how much you plan or how much you think something is going to go one way. It's always the curveball that comes out and throws you basically for a curveball. It throws you like, oh my God, like what just happened? Or you have to make a split-second decision about what you're going to do or how you're going to come back from what just happened. Because usually people get punched in the face, they're on their toes. They didn't expect it to come and hit them in the face. Nobody does. Nobody expects something bad to happen. Nobody expects to get punched in the face first before they can maybe dodge it, knock it, or they think they're going to hit that curveball that's coming in because they didn't know. They thought it was a fastball. They're going to hit the curveball. So at that point, be prepared. That's the only way. And train. And I'm not talking about training at a gym, but for whatever you do, if you train, you're going to get better. That's when muscle memory kicks in. That's where, if you're in that split-second decision, you're going to know what you're going to do next just by muscle memory, just by being able to train and getting into that consistent routine of whatever it was. And this can apply to your training. This can apply to your diet. Not knowing some of these different things are coming out of the woodwork and coming in from a left field or curveball. So be prepared. Make sure you have a plan A and a plan B. So if you do get punched in the face, you know what you're going to do next. Don't get caught on your toes and not knowing and stumbling and fall backwards and hit your head. You don't want to do that. So that's just some good advice, because I know that me and Cherise in Titan Medical Center in the 8+ years we've been in here, when everything is going right and you're just like, oh, everything's running smooth, that's when the curveball happens. When everything's going right and you're like, oh, we're breezing, we're moving. That's when the punch comes. And then what do we do when we get hit? And that's where I think, where me and her have excelled at, because we've been hit a couple of times in the face and just not got knocked down, just knowing what we were going to do next and going after that plan. So make sure you guys follow that advice, right? All right, so facial technology. If you guys have not seen in the news, facial technology, Amazon, Google, okay, Microsoft, especially Amazon, they own this software and technology for facial recognition. And the big thing about it is they were licensing this software to the government. So the government was using this. Police were using this facial recognition to help them catch criminals, okay? So with everything that's happened, especially lately with police brutality in some of these states with these different officers, and it's not all officers, I want to make that clear. So Titan Medical Center has a lot of LEO, a lot of police officers out there that we back 110%. So it's not all the police officers. There are some bad police officers out there that obviously need to get removed. There's bad people in every race out there that need to get called out. I don't care if you're Greek, black, white, Chinese, Latin, Asian, whatever you are, whatever you assimilate as, there are some bad people in that specific function or a race. That's what it is. There's bad people in different jobs, in hormone replacement, in plumbers, in contractors. You're going to find good ones and bad ones. So just remember that, guys. But at that point, with this facial recognition technology, they basically suspended it from the government and from these police agencies from using, which is kind of good, I guess. It's because they're not going to be able to use this technology, which this technology has to be very, very serious. And for the government not to have it already, that was one big thing I had a question of. I don't understand why the government doesn't have this technology, but they don't. So with that being said, it's kind of crazy. So who knows what other programs or software they're running against us. So you guys, be careful, with the CrossFit thing, with that, with all this technology out there. Be careful what you're writing, be careful what you're saying, because you never know who's listening, right? And you never know who's going to screenshot what you wrote and send it to 1 million people to have people coming after you. I've seen that look crazy too. Screenshots and just going after these people. So it's nuts. I've seen a lot of different people, like I said, lose a lot of different things during these troubling times. So that's it. That's pretty much the show for today. I want to make sure that I covered all that. I want to give away a free t-shirt or free leggings. And for girls, I got these different tank tops that came in, these Team Titan ones. You girls are going to love them. So if you're a girl, you'll win. You can get a shirt. Guys, I got V-necks, crew necks. I've got all kinds of things. So if you guys want to win, all you guys got to do is text 727-389-3220 and hashtag Titan Gear. So you're going to text the main line, 727-389-3220 and hashtag Titan Gear. Also, guys, the weekly newsletter poll. While we wait for this, I want to go over that. have you ever had your hormones checked? So that was the question. It was a question because we brought up about the Father's Day special and the blood special this week that's going on, and we want to see how many people have really got their hormones checked. So let's go over the results. All right, so 13 people said yes. Or is that 13%? So
13 people.
13 people said yes, right? 5 people said no. 3 people said no, why should I? Because it's for your health. That's a good one. How do I get this done through Titan? Wow. So people actually asked that. So if you have questions and how to get blood testing done through Titan for your hormones, call or text 727-389-3220. If you don't or you haven't got your hormones, why? You know, maybe you're a little bit younger, like a 20-year-old, and you don't think your hormones need it. You might not. But like I said, if you're 30 or above, you really should check this. And no, why should I? It's for your health. We want to make sure you have. And for you guys that have out there, that was the biggest number. Congratulations. You guys knowing exactly what's going on in your body. Hopefully you guys are fixing it. Or maybe there's nothing to fix. That's another benefit too, right? You guys can see that. There's not always something that's going to be wrong. But if there is something wrong, you guys want to fix it, check it, make sure it's done. David Hensley, glutathione is a new favorite. Yes. So David Hensley, glutathione is definitely and should be one of your top ones all the time. Titan gear is on point. Jen McHenry, IFBB Pro. We love it. Team Titan member and Titan family member. And Mike Neal, he gets his blood test every 4 to 6 months, which is really, really good. That's definitely a way to do it. Blood work is so important. So that's great. So with COVID-19 coming around right now, I might as well talk about it. Coming back, or the spikes going back up, we want to talk about, and you guys should worry about this too. So COVID-19 is just one virus. And before COVID-19, we cannot forget there were a ton of viruses and common colds out there and strep throats out there and all sinus infections and all these different yucky things, right? So there were things before COVID-19. So if you get sick, don't automatically think it's COVID-19. Get checked out. But it could be something else, all right? So don't freak out, too. There was different things around before COVID-19. So make sure you guys are doing that, all right? But with that, you guys want to boost your immune systems. You want to boost your immune systems as best as possible, especially if you have to go out in public. Because if you have to go out in public, you might be exposed or be around people that have COVID-19 or some of these other bacterial infections or sinus infections or viral infections that you guys do not want to get. So you guys want to boost your immune system. We've got a number of different therapies that will help you do that, from injectable vitamin C to glutathione, which is a super antioxidant, thymosin alpha-1, which is an awesome peptide as far as boosting your immune system and boosting the T cells in your body to help you fight off viral and bacterial colds. There's a lot of different things we use. Zinc chloride, that's another one. And David Hensley uses it every day, the glutathione. And probably he should. So at that point, if you're in a high-risk area or you're seeing spikes or you just want to boost your immune system, these therapies are great, a natural way to help you really boost that immune system and give you the support that you guys need. All right, guys, so I think that's it. Remember, hashtag Titan Gear, text it to 727-389-3220. Make sure you guys check out our podcast, okay? Me and Big Drew, we have our podcast. We have the Titan newsletter that goes out to you guys every week, and if you guys want to sign up for that, all you guys got to do is text the number 22828 and hashtag Titan Medical to that. You got, or not even hashtag, just Titan Medical. Instagram, Facebook, Twitter, TikTok, YouTube. Subscribe, especially to YouTube. Hit the subscribe button. Hit the bell for all notifications. Lock it in. Titan Medical Center, right? On Facebook, on Instagram, Titan Medical. Look it up. Follow it if you guys aren't. Share this, please. If you guys are on Facebook, share it. If you guys are on Instagram, tag some people in this. Please. They should like or want to get this information, hopefully, because it'll educate them and hopefully help them or a family member or loved one. So I think that's it for Titan Talk Tuesday. I appreciate you guys tuning in. I'll see you next week for Titan Talk at 6 p.m. every Tuesdays. I appreciate you guys. Thank you, and I'm out.